Thank you so much, and I'm delighted to be here. I'm Director of Policy at the Food Standards Agency, as you've just heard, and that does mean I get involved in pretty much everything that the Food Standards Agency does. And just to give you a little bit more of a flavour of what that is, I like to think of policy as the jam in the sandwich. So between science and evidence on the one hand and enforcement on the other, to put it really simply, we look at the evidence, we decide what to do, and then we put that regulatory approach into practice. And policy is the decide what to do part. Now this conference has a very broad theme, and I confess I have found it difficult to narrow down my talk today because there is so much that we could talk about. So what I've decided to do, I'm going to tell you more about what the Food Standards Agency has done during the COVID-19 pandemic to keep consumers safe, protect the UK's food supply, as we heard earlier. This is the global food supply, we're all very well aware of that, and represent consumer interests. And I also want to talk to you about the FSA's new responsibilities now that the transition period has ended and the UK is fully independent outside the European Union. And I'll let you be the judges of how successfully I weave together these topics. For me, the theme that brings them all together is trust. And I'd like to start by reminding you of the Food Standards Agency's vision, which is food you can trust. And you can see that trust is something very central to the way that the FSA works and something that we think deeply about as a regulator. And trust has also been in the spotlight recently for different reasons. The COVID-19 pandemic has highlighted just how important it is that people trust the information they receive. Trusted information will be acted on, but the sources that people trust are not always reliable. And the challenge for regulators and for public health authorities is therefore twofold. Firstly, to ensure that we are amongst the most trusted voices so that consumers turn to us for information about how to make good choices and stay safe. And secondly, to work with and through others so that our message is supported and amplified, reaching all our citizens wherever and however they prefer to receive that information. Trust. Well, a simple way is to ask people, and our regular survey that we do at the Food Standards Agency, which is called Food and You, and many of you may know about this, has been tracking public trust in the Food Standards Agency for more than 10 years now. So can we move on then to the next slide? Let me have a look, see if this is going to work. Oh, perfect. I've gone too far, in fact. Here we go. So as you can see, the Food Standards Agency is a very trusted regulator. We have what we call a trust index, which is something that we developed for the first time last year, and it combines responses to a number of different questions in our survey. And on that index, we currently score 7.7 out of 10, which is a very, very high score. And trust in the FSA is high, and it has in fact risen steadily over the years, which is really great. 73% of people trust the Food Standards Agency to do a good job overall, and 68% believe that the Food Standards Agency provides truthful and reliable information to the public. So, delving a little deeper, we've also been able to look at whether levels of trust change depending on people's characteristics, for example, their age, location, or ethnicity. And what we find is that there isn't a significant difference in levels of trust depending on where people live or by gender, but we do find that for younger age groups and people from non-white backgrounds, they do tend to have a lower level of trust in the FSA. Now, these results were published in 2019 and updated in December. Some of those figures are the most recent ones we have from our last survey. But really, the experience of the COVID-19 pandemic has shone a spotlight on the potential consequences when some people trust public health advice less than others. And this is a wake-up call to all regulators. We must absolutely treasure the trust we hold where it is high and build trust where we can do better. It's not a popularity contest. Sometimes people think that public organisations and regulators who are looking at levels of trust like this are kind of looking, it's self-congratulatory. It's absolutely not. Trust is fundamental to our ability to do our job. So, how does a regulator build trust? Do you want to come back to me now, because I'm going to show some more slides later on, but we don't need to be looking at this one, I don't think. It might be a bit distracting. Thank you, brilliant. So how does a regulator build trust? And I'm going to focus on 3 ways that we do this in the Food Standards Agency. The first is transparency, especially in how we present and communicate the science and evidence that lies behind everything we do. The second is joint endeavour, which is working really closely with a very broad range of stakeholders from right across the food industry. That's why events like this and organisations like your organisation here are so important to bring together that broad range of voices. And the third is consumer focus. And in the Food Standards Agency's founding legislation, we are tasked to represent consumer interests in relation to food. Consumers need to know that we've got their backs, and I'll be showing some of the ways in which we've done this throughout the COVID-19 pandemic. One of the most important roles of the Food Standards Agency is to let people know what is safe. And very early on in the COVID incident, we published our risk assessment that said the risk of exposure to COVID in food or from food packaging is very low. Now, I don't absolutely know for sure, but I believe that we were one of the first food safety regulators in the world to publish a risk assessment on COVID and food. We were very aware of the intense public interest in this issue and also the potential for misinformation. So we mounted a cross-channel social media campaign, including Twitter, LinkedIn, Instagram, Facebook. And on Twitter and LinkedIn, our post about the very low risk from food has been the top performing COVID post last year. And I'd like to focus in now a little bit more on our approach to science and evidence and illustrate this specific COVID study. Transparency means much more than just giving people the answer. It means shining a light on all stages of the process. And that starts with deciding which questions need to be answered, to communicating what we don't know, what we do know. So if we could go back to the presentation now, I'm just going to illustrate how we present some of this information. Thank you. So this is a specific study, an example of a different COVID risk assessment, and I'm going to just show you 3 slides here that illustrate 3 aspects of our approach. So this particular study was around coronavirus risk via shellfish and crops that are grown on land treated with sewage sludge, so it's quite specific. And you can see the first thing that we do is we publish there our risk question. So it's just really clear what it is we've been looking at and thinking about, and then people know what it is that they're going to find out. So then the second aspect is that, as I said, we give our answer in straightforward language, the risk very low, we use the sort of standard risk language, and you can find out more about that if you want to by looking on our website. And then the other thing that's really important in risk communication is to be clear about what we don't know. So what is the level of certainty that we have, or uncertainty that relates to the available evidence? And obviously in a COVID environment, as we were all learning, there was really quite a lot that we didn't know, and in fact still don't know. And so the Food Standards Agency has a programme of research which is continuing to look more deeply into some of the questions that we need to know the answers to. But we will always be transparent about what we're looking into, our conclusions, and we'll be transparent about what we don't know as well as what we do know. So if you could come back to me now, and we'll come back to the slides again in a moment. Thank you very much. So COVID has dominated our landscape for the past year, but I want to look forward now, and I want to explain how these principles of transparency will be applied as the Food Standards Agency takes on these new responsibilities that were mentioned outside the European Union. So the FSA is now solely responsible for advising ministers in England, Wales, and to some extent Northern Ireland about food and feed safety issues. In Scotland, this role is the responsibility of Food Standards Scotland. Obviously in Northern Ireland, under the terms of the Northern Ireland Protocol, they will be following the regulatory approach of the European Union, but the Food Standards Agency does very much still have a role in Northern Ireland. So previously this overall role, as I've said, was undertaken by the European Food Standards Authority and decisions taken by the Commission. Now, for the Food Standards Agency now, in respect of England and Wales, our new risk analysis process sets out exactly how we're going to carry out these responsibilities. And I'm just going to pause and explain briefly here what I mean by risk analysis. If we could go back to the slides, please. So risk analysis essentially uses science and evidence to provide advice to government, business and consumers on food safety risks. The issues will be very familiar to people at this conference: control of pathogens, for example, allergens, novel foods and novel food processes, anything that you can think of that might need a regulatory decision. And in taking those regulatory decisions, we also consider what are sometimes called other legitimate factors. And some examples here might be animal welfare, environmental, economic impact, consumer views, which I'll talk about a little bit more detail later on. But lots of things that we have the opportunity to take into account. And just to say a bit more about how we've approached this, in the Food Standards Agency, what we've done is we've restructured ourselves so that we have a very clear separation of the risk assessment, the science and evidence risk assessment, and the risk management. So if you remember that sandwich I talked about earlier, the science and evidence and the risk assessment is one part. The risk management question, what we do about it, is another, and we've separated those out within the agency because it's very important that the risk assessment and the science and evidence are reviewed and interrogated independently. In order to support that process, we've got scientific advisory committees already well established, but we have expanded them. We have new experts, new expert groups, and you can see in the figures on the right-hand side some details about how we have grown, and a new process for regulated product authorisation. So in food standards and safety legislation, it's laid out which specific types of product need to go through a regulatory process before they can be placed on the market, and that process is now the responsibility of the Food Standards Agency. And as we said in the introduction, a really good example of that is the new regulatory process for CBD, and we've had many applications for CBD products to go through the authorisation process. So. Now, and some examples of the kinds of things that have been through our risk analysis process recently. And now this slide, there's a huge amount of information on this slide, and I don't expect you to be able to read all of the detail here. I think the slides will be available after the conference if you'd like to look at this in more detail, but essentially it shows a kind of an end-to-end view of how the risk analysis process will work. And the reason I'm showing it, although I know you won't be able to read all of the detail, is just to focus in a little bit on that right-hand side, where you can see all of the different opportunities and the different points that there will be during this process for information to be placed in the public domain. And you know, when we say that we want to be transparent and we want people to know what we're looking at, we want people to know what our risk assessment says and we want people to know what the regulatory decision is, and also to have opportunities to get involved in some of those stages. We really mean it. So we will be publishing on the Food Standards Agency website and through our regular board meetings and reports to those board meetings, the list of issues that we're considering. Our scientific committees already operate very transparently, and the agendas and the minutes and some of the papers are available. Obviously that would exclude commercially sensitive information. We have a formal consultation stage for many issues, and obviously that's another opportunity for people to get involved. And we will be summarising progress to the Food Standards Agency board, including the list of recommendations that we've put forward to ministers. And as you saw earlier, we publish our risk assessments as well. So there are many points at which people can inform themselves about what issues are going through the process, and really think that that's going to support the trust that I spoke about earlier on from many different stakeholders. So if you could now come back to me for a moment, we don't need to look at this slide, I don't think, for any longer. Thank you very much. I'm now going to say a little bit about the second principle that I mentioned, which is, we call it joint endeavour. Regulation is a partnership. It has many positive benefits for industry and consumers. Something that people will be much more aware of now and over the next few years is that having a trusted and independent food safety regulator is a really important foundation for successful international trade deals. So if our trading partners and consumers in other countries trust that our food is safe and produced to high standards, then this will promote international trade. And regulation provides a level playing field for industry, and of course it means consumers can have trust in what they eat. So the COVID-19 pandemic, I think, has both strengthened and also tested some of our regulatory relationships. They've been strengthened because partners and stakeholders, they can really see the value of clear and independent risk assessment and regulatory guidance. And absolutely throughout the pandemic, the FSA has provided detailed, tailored and timely advice to food businesses who are going through one of the most challenging periods in living memory. And huge numbers of small food businesses have been forced to close, temporarily or sadly in many cases permanently. And at the FSA we've produced tailored guidance for use by businesses restarting or for businesses starting for the first time. And we've done this under a banner called Here to Help, which I think goes to the heart of one of the things we mean by joint endeavour. And we've got a new section on our website which directs businesses to this support. And our industry portal, which explains what to do if you're reopening or adapting your food business. Again, it was one of the most popular pages on our website, particularly in the July to September period last year, when, as you'll remember, there was some reopening of food service businesses. And people were going straight to this page, so there were more than 165,000 page views in that 3-month period alone. And the most downloaded document from our website this year has been our reopening checklist, and that's had more than 22,000 downloads. So, and I'm telling you this because the economic role of a regulator, I think, is often overlooked. Regulators aren't just about telling people what they can't do. Regulators are absolutely at the heart of building consumer and business confidence. And we know that right now at the FSA, our role is to make it as easy as possible for businesses, consumers and everybody in the food system to do the right thing. And if our regulations aren't clear, if the guidance isn't clear, then businesses will face unnecessary barriers and consumers won't have confidence in the system. So we've also been flexible and I think responsive in the way that we regulate. We know what huge pressures there have been on local authorities throughout this period. So we've worked with them to make sure that the very scarce resources that they have are used in the most effective way. And this has included changing guidance for local authorities so they can concentrate on the most important interventions. So, for example, lower risk businesses, if they have a food hygiene rating score of 3 or higher, we've advised that some planned interventions can be deferred. As you'd expect, public safety is paramount, so we always take an evidence-based approach when we're flexible. It does mean that some businesses have been waiting a little bit longer for their food hygiene rating scheme rating, whether it's a new rating or a re-inspection, and we know how important these ratings are to businesses, and we've advised local authorities where appropriate to prioritise new ratings. And after a sharp drop in March when lockdown started, we have now started to see numbers of new ratings increase steadily, but not yet back to pre-pandemic levels. So we know that things are still very different during COVID for local authorities and for businesses. We've also been a very strong voice within and outside government for the importance of ensuring that local authorities have got enough resources to do their key role. And we've fast-tracked some planned changes to in the Food Law Code of Practice, and we'll be introducing a new competency framework. And this is going to help local authorities draw on a much wider range of suitably qualified individuals, helping to ease that immediate pressure on resources and building resilience for the future. And those changes are coming in at the moment in England and in Northern Ireland, and later on this year in Wales. And that should really help to again make best use of that limited expert local authority resource. And then finally, in the FSA, we've also been an integral part of the cross-government response to ensuring that the food supply continues to run smoothly through the many disruptions of the past 12 months. And we can all look back to the early months of the pandemic, I think, and remember that some products were missing from our supermarket shelves, and the period when buying patterns changed, and it was perhaps a bit harder to get hold of some foods, and we could see that throughout the supply chain that there were adaptations to some very different needs. So the food industry asked for more flexibility in applying certain labelling regulations, so that some products could be repurposed to maintain supply and reduce food waste. In particular, as retail demand surged, products that had been previously designed for catering and hospitality remained unsold, as we've seen. Many food businesses had to suspend trading, so the catering and hospitality supply chain was very disrupted. So one of the things that the Food Agency wanted to do was to put more onto retail shelves and to repurpose some of those products that had been in catering and hospitality supply chains. But that would require, in some cases, a different approach to labelling. So the Food Standards Agency took this very seriously. Labelling regulations are absolutely core bedrock of food safety and standards, and so important that consumers know that they can trust their label. We held an extraordinary board meeting to discuss the issue, and we did agree some temporary flexibilities, but we also laid out some very clear red lines to protect consumers. So we were able to work in partnership with industry and enforcement authorities to make sure that the guidance was proportionate, clear and understood. In fact, in the event, it turned out that the industry managed to cope quite well without needing to make extensive use of the flexibilities. But I think it was a really good example of how, as an agency, we moved quickly and we were flexible to meet the needs of industry whilst protecting consumers. Finally, I want to say a few words about consumers. And referring back to our founding mission to represent the interests of consumers in relation to food. And I mentioned our regular survey, Food and You, which is one of the ways in which we find out more about what consumers think is important. And during the COVID pandemic, we also supplemented this consumer research with some different approaches so that we could really focus in on what that consumer experience had been and use that in our regulatory approach. So, we did some additional surveying, we did some specific qualitative research, and also we did in-house social media listening, which is an increasingly important way to find out what people are talking about. And we established a COVID-19 expert panel drawn from the FSA's network of leading researchers and experts. And I can show you a few of the findings if we can go back to the slides now. Well, that's just an example of one of our Here to Help case studies that I didn't show you earlier. So thinking about some of the things that we found when we talked to consumers about their experience of food during the COVID pandemic. Some interesting information about how people feel about eating out. So this was obviously during a time when there was still the opportunity to do that. Only 10% of people in autumn 2020 said that they would feel safe to eat out. At home, we saw an increase in people who were reporting that they were eating food after the use-by date. Unsurprisingly, people who were experiencing financial insecurity were more likely not to look at the dates. And 20% of people were reporting to us that they had cut back on meals for financial reasons. Particularly younger people, those with children and those with a health condition are more likely to experience food insecurity. And I don't think those findings would be surprising. So if you could come back to me now, that's my last slide, I think. Thanks very much. And we use this insight in a couple of different ways. So we make this information available. We're an independent voice. We're one of the ways in which government and policymakers can understand what consumers are experiencing, what risks there might be, what's important to them, and we use it to inform our own regulatory approach. And one example of that is the work we've been doing on food hypersensitivity. This year we had planned a very hard-hitting campaign aimed at small and medium-sized businesses to shine a spotlight on business responsibility to know about allergens and communicate information to consumers. The message is as relevant as ever, but these COVID insights did confirm that the time hasn't been right to undertake a business-facing campaign. So we did something very different. We know that takeaway and home delivery services are thriving, and young people remain highly active on social media, perhaps even more so during the pandemic. So we changed our plans, and we are currently running a campaign focusing on young adults. Speak Up for Allergies is live now, and we're expecting that we'll have opportunities to reach and influence up to 4 million consumers through this campaign. So the message of this is always ask about allergies, even if it's a meal you've eaten before. And again, just going back to the partnership working theme, getting that message out through organisations like Mumsnet, working with Just Eat, and using some prominent social media influencers and bloggers to promote the messages to that group of young people that we believe are at risk. So I said at the beginning, consumers need to know that the FSA's got their backs, and our work on allergy, I think, is a great example of where the FSA's spoken up for consumer interests and priorities. Just finally, to highlight that a great example of that is in autumn this year, we're introducing what's widely known as Natasha's Law, which, as many of you know, is where businesses will have to have full ingredients labelling with allergens clearly stated on foods known as pre-packed for direct sale. So, for example, a sandwich made on the premises, made fresh on the day, but packaged, ready to go. And they're waiting packaged up for consumers to come and take it off the shelf. And the FSA spoke up for consumers in recommending this change and is now leading the implementation. So to sum up, I've covered a lot of ground. So I hope I've given you an insight into how the FSA approaches regulation, what we've learned from COVID-19 and some of the things that we've done during the last year that have been a bit different in response to the pandemic. And how we'll use those lessons and that regulatory approach to take on the new responsibilities that we have in future. And in my view, the regulator of the future will absolutely need to be trusted, responsive, flexible, transparent, and with the interests of the consumer at heart. And this is what the FSA will absolutely strive to be. If we could just go back to the slides briefly, I've got some links and you'll be able to look at those, I think, later. So I've just given you a selection of places. If you want to find out more about any of the things that I've talked about, you'll be able to follow those links and have a good explore on our website, which is where we make all our information available. Thank you very much.